who should consider taking cholesterol medications. Have you ever wondered who might need cholesterol medications? This is an important question, especially since high cholesterol can lead to serious health issues. Let's break it down in simple terms. Cholesterol medications, particularly statins, are often recommended for people with high levels of low-density lipoprotein cholesterol, commonly known as bad cholesterol. If your levels are significantly elevated, you may be at a higher risk for atherosclerotic cardiovascular disease. This includes conditions like heart disease, strokes, and issues with blood flow in your limbs. So, who exactly should think about taking these medications? First, individuals between the ages of 20 and 75 with very high low-density lipoprotein cholesterol levels, specifically those at or above 190 milligrams per deciliter, often need treatment. These individuals usually requiring the highest tolerated dose of statins to effectively lower their cholesterol. Next, if you have already experienced a heart attack or stroke, cholesterol medications are generally recommended. These medications help lower the risk of having another cardiovascular event. For adults aged 40 to 75 who have diabetes, even if their low-density lipoprotein cholesterol levels are between 70 and 189 milligrams per deciliter, cholesterol medications are often suggested. Diabetes increases the risk of heart disease, making these medications important. If you are between 40 and 75 years old and do not have diabetes, but your estimated risk of cardiovascular disease over the next 10 years is 7.5% or higher, you may also be a candidate for cholesterol medications. This risk is calculated based on factors like age, blood pressure, smoking habits, and cholesterol levels. Additionally, if you have one or more risk factors for heart disease, such as high blood pressure or a history of smoking, and your estimated risk of cardiovascular events is 10% or greater, cholesterol medications may be advised. Lastly, if your triglyceride levels are up to 300 milligrams per deciliter, and you are not seeing enough reduction in low-density lipoprotein cholesterol with statins alone, additional cholesterol-lowering medications might be considered. Cholesterol medications primarily work by lowering low-density lipoprotein cholesterol levels, which helps reduce plaque buildup in your arteries. Statins are the most common type of these medications, and they not only lower low-density lipoprotein cholesterol but can also lower triglycerides and slightly increase high-density lipoprotein cholesterol, often referred to as good cholesterol. Before starting any cholesterol medication, healthcare providers will assess your overall cardiovascular risk and health conditions. It is also important to remember that lifestyle changes, such as a healthy diet, regular exercise, and quitting smoking, are essential parts of managing cholesterol levels and overall heart health. In summary, cholesterol medications should be considered for individuals with high low-density lipoprotein cholesterol, existing cardiovascular disease, diabetes with elevated cholesterol, or significant calculated risk of cardiovascular events. Each decision is personalized based on individual risk factors and cholesterol levels to help reduce the chances of serious heart-related issues.